The next category of drugs that we see for epilepsy or other seizures is a drug called carbamazepine. Trade name is Tegretol, and this is also referred to on page 172. It also alters sodium channels on the membranes of the brain cells, and by controlling the amount of sodium, we can slow down how the neurons refire, and that sort of cuts down on abnormal electrical impulses. This is a common drug that's given to control epilepsy with children. Sometimes it is used as a mood stabilizer or can reduce skeletal muscle spasms. Side effects are ataxia, so the person can get kind of clumsy, nausea and vomiting, as well as constipation, some itching and rash, and photosensitivity. So you want to keep an eye on the person's skin very carefully, especially in a child, and it can cause the person to feel some muscle weakness. More serious effects would be abnormalities with the blood, cardiac dysrhythmias, severe hypertension, so you want to keep an eye on the patient's vital signs. These particular drugs interact with a lot of other drugs, so you're going to have to consult the product package insert in the Tegretol container and look at what it says about interactions and see what drugs the patient is on and do some patient teaching, or maybe the patient might need some other drugs changed. Warfarin especially does not mix very well with Tegretol, but you probably don't have to get very far into this class to realize warfarin doesn't really interact well with a lot of things. When it comes to the carbamazepines, you want to take a look at those nursing implications on page 172. There are 6 bullet points. This drug is teratogenic, as are many of the seizure drugs. They should not be used during pregnancy. You want to make sure that you do thorough assessments on these patients, baseline vital signs, and remember that Tegretol can cause cardiac abnormalities. The person is going to be ataxic, so there's an increased falls risk. So you want to warn patients to kind of watch what's on the floor at home, pick up scatter rugs, wear good solid footwear, non-skid footwear. And you want to take with food or some kind of a snack because there are so many GI side effects with Tegretol. All right, continuing the drugs for epilepsy, we come to another drug on page 172, ethosuximide. This belongs to a whole category of seizure drugs known as the succinamides, which I always told my students, just remember it really sucks having seizures. They only talk about one here, ethosuximide or Zoranton. And rather than controlling sodium channels like the previous 2 drugs have done, these are calcium channel controllers. They open or close the calcium channels and allow the influx and outflow of calcium in the brain cells. You can expect to see some side and adverse effects like heartburn, which sometimes is known as dyspepsia in the medical world, nausea, vomiting, dizziness, drowsiness, and the person can get very tired taking Zoranton. Next category of drug is a category called the Barbiturates, and once again this chapter just highlights one drug out of that collection of barbiturates, and this is phenobarbital. Phenobarbital has long been known for treating epilepsy. A long-acting form of phenobarbital is called Luminal, and the book also talks about micelone or primidone, micelene or primidone. A barbiturate is a pretty heavy-duty sedative, and so it acts to sedate the brain and calm down any electrical impulses that are not normal. One of the actions of the barbiturates, like phenobarbital, is to imitate the action of GABA. Remember how I talked about how GABA is sort of the mother of the neurotransmitters? It sort of calms everybody down. So anything that acts like GABA in the brain acts as a sedative or something that calms down the brain's action. It's a central nervous system depressant or suppressant. So this is going to sort of sedate the abnormal impulses that can lead to seizures. Signs or side effects, you're going to see drowsiness, clumsiness, blurred vision, mental status changes. The person's going to be kind of loopy. Adverse effects, central nervous system depression. Phenobarbital and the other barbiturates are Schedule 4 controlled substances, and so there is a risk of physical and psychological addiction or dependence. There's some other side effects listed on page 173 of your book. And the main interactions we see are other central nervous system depressants. So you don't want to take phenobarbital along with alcohol or opioids or other sedatives because you can get too much central nervous system depression, and the person can, their breathing can be affected, their cough reflex can be affected, and they can become unresponsive. Phenobarbital and primidone are also teratogenic. They should not be used during pregnancy. They can cause really bad respiratory depression, leading to coma and eventually death if they're taken with other drugs. And you're going to have an increased risk of falls because of that ataxia, that clumsiness that central nervous system suppressants cause. You want to look back on page 171 and read general nursing considerations for CNS drugs, as well as patient and family teaching points. These are very important to do if you end up working in an office where you're working with a number of seizure patients. Our last drug that is in the traditional category is a drug called valproic acid, or Depakote. This raises the seizure threshold, makes it more difficult for the brain to be stimulated into seizures, also by increasing the activity of GABA in the brain. Side effects that you might see are drowsiness, some muscle weakness, nausea, diarrhea, and menstrual irregularities in females. Adverse effects, cardiac irregularities, hearing loss, and a possible GI bleed. So you want to keep a close watch on patients who are taking Depakote. There's a list of drugs that interact with the traditional, or the list of drugs that interact with traditional epilepsy meds. There's just many more than we can go into here. So with each individual drug, you're just going to have to keep a close eye. But some of the ones mentioned, diabetes meds, warfarin, which once again doesn't go well with anything. Make sure you look at the lifespan considerations on page 173, as well as that safety tip. Parents of children who are taking Depakote, you want to look for signs and symptoms of liver toxicity, such as jaundice, darkening of urine, or light-colored stools. Immediately call the healthcare provider if you suspect any liver damage. You want to give an IV infusion very slowly so they don't irritate the vein. Once again, these are not used during pregnancy. Valproic acid can also be used as unlabeled use for migraines and bipolar disorder. They've had some success for people with BPD.